All right, welcome everyone. This is a chat interview with Dr. Tara Kulikov. We are going to be discussing our new program called Overcoming Breast Implant Illness, the Roadmap to Overcoming Breast Implant Illness. It's a self-guided program. And this program was really inspired by Dr. Tara's experience through having breast implant illness, as well as going through the surgery, the explant surgery. And so she's going to share some of her pearls and experiences, and I'll be asking her some questions along the way. So again, I'm Dr. Kendall Perrine. I'm a naturopathic doctor located in Southern California. And here we have Dr. Tara Kulikov. And do you want to go ahead and introduce yourself, Dr. Tara?
I am Dr. Tara Kulikov, doctor of acupuncture, Chinese medicine, and exercise physiologist in Northern California.
Great. And you've been a patient of explant surgery of breast implant illness as well. So, little background, Dr. Tara came to me with the idea of creating this program for women with breast implant illness. We've been friends for many years, and I watched her health deteriorate as her symptoms of breast implant illness affected her daily life and vitality. So, being the strong, determined, proactive woman that she ultimately decided to undergo the explant surgery. And like we touch on, and we see a lot in both of our clinics, myself in Southern California, the road to wellness is not always linear. But through this process, we brought some awareness to the area of breast implant illness, and we want to increase discussion and awareness on this topic. Because clinically, we both see patients with this particular problem and symptom, having these implants, and a lot of times they don't connect the dots that their symptoms might be related. So that is basically our goal, bringing awareness and filling the gaps where needed with care. So first of all, let's just talk about you and your experience, Tara. How long did you have breast implant illness?
Yeah, good question. And just to kind of deviate, this is not all about me, right? But sometimes we know that if a woman shares her story, it can touch another woman's heart, soul, mind to open them up to the awareness about any condition, and in this case, breast implant illness. So the question was, when
How
did I get
long,
breast implants?
how long did you have
Yeah,
breast implants?
I had them for about 19 years, a long time.
Okay. So what, around age 20, 25, 26, you got those
25.
in?
Yep. Mhm.
Okay. Okay. And what was your reasoning for getting breast implants?
That's a very big question, and I was thinking about that again this morning. I think really what it comes down to is like generational differences is the root of it, right? Um, I historically blame it on generations before mine. I don't think I was raised to be proud of my genuine body and self. I was always extremely athletic, extremely fit, extremely thin. And typically, what goes with that is very small boobs, right? Very low body fat typically equals very small breasts. Something that I should have been proud of is my athleticism and my strong body, but somehow, with all these generational differences of what is considered to be an optimal woman, I think got into my head and my mind. I believe in my mother's generation, almost all of her and her friends have breast implants, right? Isn't that
Oh,
crazy?
interesting.
Yeah. So I think I finally decided, well, let's give this a shot. Let's try it out. I definitely remember times growing up in, middle school, high school, where I was made fun of. I was always self-conscious about that. So I decided to see what would happen if I changed that about myself.
Yeah, yeah, I'm sure a lot of women can relate to that exact experience and reasoning for getting them.
Yep.
Okay, so at what point did you start not feeling like yourself when you had breast implants?
Yeah, that's a really good question. I would think it was later on in the 19 years, but if I think back, I think it was much sooner on. It was like about a good year later after I had them that I also had a really gnarly surf accident. So I was cut open by a surfboard fin and lacerated almost to my femoral artery, very traumatic event. And I think that's when I remember a shift in my whole life. Um, And I think what historically has happened, or what happened with that, is that the inflammatory process occurred because of that injury. And then the body recognized, oh, well, we also have these in us, right? So let's just piss off the whole system. Because from that point on, I became sensitive to everything. Like every food I ate, I was sensitive to. I had horrible digestive problems. I had horrible hormone problems, like missed periods, light periods, heavy periods. And so it's really, I would say, like a year or two in, and I just kind of dealt with it, until it got so bad 19 years later that I literally could barely even function throughout my day.
Wow, that sounds like a journey. It almost sounds like an autoimmune sort of picture, like
100%.
your
Yes.
body was so inflamed from these foreign objects in your body, and then having that traumatic event on top of it, just your body going into hyperdrive essentially,
Yeah.
sympathetic mode. So you described that event, thank you. And then what were your signs and symptoms as you kind of started to pick up on the fact that you were having symptoms?
Okay, so I had a lot, and we'll start out with the beginning ones. As I mentioned, I think what it first started out was with food sensitivities. Like all of a sudden, I couldn't eat bread, or so anything gluten, then any nuts, then any corn, no shellfish. Like the list just went on and on. So I just kept having to eliminate things, and I thought that was the solution, right? And this is what happens with women with breast implant illness. And then you go to another thing. Okay. Then it's inflammation. Then we're going to try this like anti-inflammatory diet. Right. And then it's hormones. And then we're going to try to work on our hormones. Um, so it just went on and on to, I would say at the very end, my biggest things was shortness of breath, chest pain, vertigo, dizziness, uh, extreme fatigue, if I didn't say that, but pain was pretty significant, and they would all happen at once, right? So I would have this chest pain, and sadly for me, it was on the left side, right? I definitely went to the emergency room at least 3 times with left-sided chest pain. That I also had vertigo and dizziness, shortness of breath, and heart palpitations. Like, what do you think's happening? You think you're dying of a heart attack, right?
Yeah. Yeah.
Yeah. So that was pretty debilitating towards the end, and then after I learned about breast implant illness and I checked the boxes of almost all the signs and symptoms, I just wanted those things out. I'm like,
Yeah.
get them out now.
Yeah. Wow, what an evolution. It sounded like it started out, more insidious with some food sensitivities, and then it became extreme, ending up in the ER with severe chest pain and dizziness, thinking were having a heart attack or dying. Yeah, I'm sure some women out there can relate, so I'm glad we're talking about this. I guess, okay, so thank you for sharing that. And then what have you seen clinically as an acupuncturist with women who have breast implant illness?
Yeah, I have seen very similar. I had a patient just a month ago, very healthy, fit patient, and she hasn't had hers in for that long, maybe only 4 years. Something very similar, right? She had chest pain, shortness of breath, dizziness, vertigo, sent to the hospital. Obviously, they're going to do a cardiac workup. That came back negative. And, they're like, you're fine. We don't know what this is. And of course, I asked the question. It's usually pretty evident if when women have breast implants. Sorry, women. It really is. But I try not to be too invasive. But I asked her, I'm like, do you have breast implants? And she says, yes. And I said, all right, this is the box we have to open. This is a discussion we have to have. Outside of that specific patient, I see a lot of hormone issues with patients. Infertility, I think this is just an inflammatory response. The hormones get really pissed off. Swollen lymph nodes is a huge one. Just
Yeah.
these random swollen lymph nodes, typically in the armpits, but also can be in the groin, and it's also in the submandibular under the jaw. That's a big one, right? And that's not normal. Your lymph nodes should not always be swollen. Shortness of breath, difficulty breathing, extreme vertigo, foggy headedness.
Yeah. Yeah, that's a big one, foggy headedness. Okay, so when you were considering getting explant surgery, what conversations did you have with family, if any?
Yeah, I kept it pretty minimal. And I think that most of my family members could hear the desperation in my voice. And I think honestly, most of my family members probably didn't want me to get them in the first place. So luckily everybody was very positive. I think a few people were like, is this really your problem? And you are going
Mm.
to get that. Like,
Hmm.
you're going to get that. Like, I don't think the breast implants are your issue. Well, great. Good for you. I do think they are my issue.
Yeah.
Right.
Yeah.
So you're going to get that from people, other doctors, friends, family members. It's probably not your issues, but hopefully in the end, people are going to be supportive. And I kind of kept it quiet, right? I didn't tell every single person in my family, but
Hmm.
obviously my immediate family, my husband had to know,
Hmm.
right?
Yeah. 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 Well, I'm glad to hear that you had some support. But yeah, that's a great thing to note is that you will receive pushback and it most likely will be from doctors. So
Yeah.
that's
Yep.
good. You have to advocate for yourself, and trust your own inner knowing that, there's something foreign and something's not right. So, being an advocate for yourself. All right. So, what can you do now that you couldn't do when your implants were still in?
I basically had to stop doing most activities that required upper body strength. So like I had to stop. Like I said, very athletic, always have been. But even simple tasks of daily living became difficult. So going back to sports, like I had to minimize or stop doing paddleboarding, right? I had to stop all chest work in the gym. Like I couldn't do bench press, I couldn't do push-ups. And that's ridiculous. That's like a major muscle of a function. Subsequently, a lot of women, and I had this, get referred pain to the scapular region. So I also had a lot of upper back pain. I couldn't lay on my back when I slept. I had to sleep on my side. Um, I have a big Sprinter van. I couldn't shut the Sprinter van door
Oh,
with that.
wow.
Yeah. Yeah. I had, at the time, my child was a baby, right? And holding her became difficult with the pain or having her lay on my chest. Um, I remember like even like opening jars, right? Like opening, like if you're going to open a pickle jar, you have to really use your chest. So besides sports, which is a large part of many women's bottom, just activities of daily living became difficult.
Okay. And then are you able to complete those activities now that
100%. In the gym this morning, I pulled out the 40-pound dumbbells, did incline dumbbell press. I can do push-ups, planks all day long, paddle. I think this summer I paddle boarded a good, I think I reached 9 miles of paddle boarding, which
whoa,
is a decent amount of paddle boarding. Yeah, so I can do all those things again.
that's
Very exciting.
amazing.
Yeah.
Yes, I love to hear that. Okay, so I'm sure this is a question a lot of women will have once they undergo explant surgery. Personally, for you, how is your body confidence now?
Yeah. So in the beginning, you're going to have issues, right? There was definitely like those, well, you're bound for at least 2 weeks, a week to 2 weeks, I believe it is. So you have no idea what's going on underneath those bandages, but when they are first taken off, it's a sad feeling, right? You're just like, oh, but know what you see in that first month is not what is to be. Things change within a good year to two post explant. And it really depends on what you started with, right? So I started with nothing. I didn't have to get a breast lift. I simply just got the explant. But now I actually enjoy my smaller chest. I'm glad that I have it because as you age, even if you natural or breast implants, they're not fun. They sag, they move. Like I have small, perky, healthy little breasts. So I would say my confidence is back, if not better. I found that even at the end of the 19 years of having them, they became bigger because I had a child and I breastfed my child, and I didn't like them. I always would wear like really tight sports bras. Was never showing them to anybody, as some women do. Um, so the confidence can come back for sure.
I love that. Yeah, I think having these conversations and normalizing a small chest, there are so many women with beautiful breasts, small chests that are healthy,
Yep.
bringing that look back and admiring it and being grateful for it is important.
Yeah. Yeah.
Okay, so if you could share one thing with other women about your experience or other, what would it be?
Yeah, so one thing that I could have done better would be to do more research on the explant surgery.
Okay.
So I did do this during like the height of COVID, right? Where many and most plastic surgeons were not doing surgery. So my options were very limited, and travel was also pretty challenging during COVID. So I had to do it within a driving distance, right? And I wasn't going to drive across the United States to get this done. But Dr. Kendall and I have, after my experience, so my surgeon did not take out the capsule,
Yeah,
right?
we're going to
So
delve into this in another
yeah,
program, but this
yeah,
is important.
yeah.
Yeah.
So that's important, is to do lots of homework on the surgeon you choose to do your explant surgery. Okay. And we can help with that,
We can
because
help with that. We have a list of,
have a list.
yeah,
Yep.
in our
But
program.
then the other thing is, like, you're just sent home with maybe this 1-page protocol for recovery, which is talks about pain medication, limited activity, and that's about it, right? And that's where that gap is.
Yeah.
It's
Yeah.
that is not enough. Just giving a woman who's had major chest surgery 5 things to do for recovery is not enough. So my
Agreed.
recovery was rough. I was in the emergency room 3 days later.
Oh my gosh, I did not know that.
Yep.
Yeah, so
Yeah.
that's where this program fits in. This is why we created it, for this exact reason, filling in the gaps, supporting women before they go in for surgery and after, so that you don't end up in the ER 3 days later like Dr. Tara did.
Yep.
So thank you for sharing all of that. We will share the link for the breast implant illness program on our Instagram account and here in the show notes on the YouTube channel. And then you could head to our link, give us a follow on Instagram. And then we also have a free guide as well that will be in the show links. It's a little bit of a taste of what our program has to offer. And then also we have some wonderful recipes in there, high protein, clean protein for supporting those women, nourishing their bodies pre and post
Recovery.
as well.
Huge. Yes.
Yes. Yeah, so we look forward to hearing from you and supporting you. We will also, we have the self-guided program, and we also offer one-on-one support virtually from both of our practices in California. So thank you for listening, and we hope to guide you on your journey.
Thank you.
Thank you.